I am really happy to see so many of you joining us for an update about the Family First Act. I am pleased to turn it over to Foster Club's new policy specialist in Washington, D.C., George White. George,
All
I'll kick
right.
it off to you.
Thank you, Celeste. Thank you all for taking the time this evening to join us for this session. Um, I'm really excited to be a part of the team here at Foster Club and really excited to give you all some updates on Family First. I will preface this conversation with an understanding that the goal here is really just to give some basic updates on what's going on with the law. So we're not going to talk too much about what's going on in specific states, but we're going to get started. And as we go through the presentation, there will be opportunity for questions and brief dialogue as well. So I know you're all muted, but we will make sure to give you all opportunity to ask questions as we go along. So with that being said, I'm just going to go ahead and get started here. All right. So we really wanted to make sure that we took the opportunity to give an overview of kind of five big questions that we have regarding the Family First Act. So as we go through, we're just going to really go through some really basic things. So the first question, that's a pretty obvious one, is what is the Family First Prevention Services Act? So the Family First Prevention Services Act is a bipartisan bill that was introduced in both the House by Chairman Buchanan and Representative Levin, and its counterpart was introduced in the Senate by Chairman Hatch and Senator Whiting. So the most significant part about this bill is that it will allow states to now use federal child welfare funding, which is Title 4E, to pay for family services for preventing foster care, such as mental health, substance abuse, and parenting program. Really, and the idea is that we want to work to prevent foster care. So as we all know, that there comes a time where there's opportunities to provide services to families that could potentially lead to a young person staying with their biological or adoptive parents, as opposed to having to immediately remove young people from their homes, which has been the traditional case. Although a lot of states have been receiving waivers, traditionally children, or states, I'm sorry, could not receive these Title 4E federal dollars for foster care unless a child was first actually removed from their parents' home and placed in foster care. So that's the first kind of big part about this legislation. So at this point, do we have any kind of questions on the big overview of what's going on? I guess there's an option where you can either raise your hand if you're online, or you can type it into the chat box, and Ryan will take a second to kind of give you the mic.
Yep.
If not, do we have any questions, Ryan? It doesn't give me the option to see on my side unless I close the presentation.
No, I don't see any questions right now, so I'm going to assume that nobody has questions at this point.
Okay, perfect. So the next question that we get a lot, that young people really want to make sure, and that Foster Club really prides itself on, is the idea of young people being involved. So the question being, were foster youth consulted in the development of the Family First Prevention Services Act? And as you can see, it's a really big yes. And for over about a year, young leaders from Foster Club, as well as members of the National Foster Care Youth and Alumni Policy Council, worked with members of Congress addressing current issues across the country facing the system. And this Family First Act is kind of what came, what came through those conversations. And these conversations were continued not just with Congress, but with the Department of Health and Human Services and other key stakeholders to really make sure that as we move forward, that the federal government is really making sure that young people are being part of the conversation when we're making federal policy. So the third really big question, and I think is the really substance of this conversation tonight, is what are the issues that Family First Prevention Services really seeks to address? And the heart of the Family First Prevention Services Act is keeping children safe and supported at home in the most family-like setting. And what that really means is that we really want to reinforce families and reduce unjustified foster care placements. And that starts by allowing states to claim the federal reimbursements that we talked about in the first slide. And so the next part is about congregate care. But I think, before that, we really want to talk about keeping young people at home, providing those services we talked about: mental health, substance abuse, in-home parenting skills, parent training, home visiting, and individual and family therapy, right? So all these services that could eventually help families stay together and not need foster care in the first place. And so for these prevention services, states would only be eligible for reimbursement if they are classified as promising, supported, or well supported based on an evidence-based structure developed by the California Evidence-Based Clearinghouse, which is a registry that helps to identify and disseminate information regarding evidence-based practices relevant to child welfare. And although this is called the California Evidence-Based Clearinghouse, it is important to note that this is actually a national registry of services that are accessed across the country. So they're not just services that are based in California. That's just the name of the registry. So are there any questions about that at this point?
And George, this is Celeste, everyone. And George, I just wanted to catch up I see we have a couple new people that have joined us, and wanted to make sure that they knew to go ahead and type questions. We have everyone on mute just to cut down on background noise. But if anyone has a question, they can go ahead and type it into the question box or chat box, or there should be a function that you can see to raise your hand, and we will unmute you.
Yes, so with that, are there any questions specific to what those prevention services look like or what that means? If not, I will move forward. So the second part is ensuring that the necessity of a placement that is not a foster home. So what's most often talked about as congregate care. So a big part of this law that has really drawn a lot of attention is that states become ineligible for federal reimbursement when children are inappropriately placed in non-family-based settings, such as group homes, congregate care, or other residential treatment facilities. So there are a couple key things. For a state to be eligible for reimbursement, the first thing the state must do is determine that the non-family setting is indeed the most appropriate. And this is subject to ongoing annual review by a judge in that jurisdiction's dependency court. And additionally, these non-family settings would also be subject to now licensing and accreditation standards that are designed to ensure that they provide the supervision and necessary clinical staff on site during business hours and accessible during non-business hours. So that whether that could be mental health clinicians, nursing clinicians, whatever kind of staff would be the most appropriate for that residential setting. Are there any questions about that aspect of congregate care, which we will talk a little bit more about on the next section? If not, we'll move to the third part of this conversation. What's really great is that this is often not talked about very much at all. And Celeste and I actually just realized this earlier today. A portion of this law is about improving support for the transition to adulthood, which we all know is extremely important, especially as a continuation of the Fostering Connection to Success Act. And that update is to the John H. Chafee Foster Care and Independence Program, which was actually originally introduced by Congressperson Bass last year. And so the idea is that states that have already opted to increase foster care to age 21 will now be able to access federal dollars through the Chafee program to provide services to age 23, including the additional services under the educational and training vouchers. So for our older foster care alumni, who are already past 18, who are now past 21, are now going to be able to access, or would be eligible to access services up to age 23. But it's important to note that that's only if their state has already passed legislation that has increased access to foster care to age 21. So if you're in a state that has not passed legislation increasing foster care to age 21, this provision in the legislation would not apply to your state. So are there any questions about that? I know I just covered a lot in that section. If not, we will power forward. So another really big question: how does the Family First Preventive Services Act meet the needs of today's foster youth? So, we all know that preventing foster care is really important, and we know that it can make a big difference in keeping families together and not torn apart through the child welfare system or being lost in the system, as we use a lot. And so through that, it'll help maintain permanency with family and with our biological adopted family and other relatives. So right now, due to the lack of prevention funding, families have been traditionally had limited option interacting with the child welfare system. So most young people enter foster care due to general neglect, and that's a very, very broad term. And so through this legislation, they would now provide services to the family and when they're in most need. So whether that be access, like we talked about, the mental health, the treatment, the mental health treatment or substance abuse, but also access to increase funding for direct services to family, which is really important. And I think we need to understand that its intent is to address the systemic problems that now shift the financial structure of child welfare to include funds towards targeted prevention that we talked about that has been classified as promising, right? So we're not saying that this is just going to be a big pot of money for states to just do what they want. We really want to make sure that we're always keeping young children and children at the heart of the conversation. So it's not necessarily an incentive to not place kids in foster care, but it's now giving an opportunity to de-incentivize the placement of children in foster care. Any questions about that? All right. So the big question has been, does the Family First Preventive Services Act defund congregate care or group homes? That is, again, a really big no. So a big common myth is that it is closing group homes, which is simply not the case. This act is going to limit the use of congregate care, and by limit, it's really limiting the federal reimbursement for congregate care. And so it's important to note that exempted from this are subgroups. There are parenting and pregnant teens, right? So if you're in a facility that's for teens that are parenting or pregnant, right, that is a qualified kind of congregate care facility. Transitioning youth and independent living programs and arrangements, again, those are still qualified as qualified congregate care facilities. Qualified residential treatment programs are, again, still qualified congregate care that are still subject to those new accrediting and licensing standards. And so what it means is that youth who are not pregnant, parenting, transitioning to adulthood, and do not have a clinical need for the treatment services and that is provided in a residential treatment facility would not be candidates for congregate care, and therefore they would not be eligible for reimbursement. So if a state decides, well, we don't have the capacity, we don't want to, figure out an alternative for young people, then the state is on the hook for funding those congregate care facilities. So it doesn't mean that they all shut down. It doesn't mean that there's nowhere for kids to go. The state just is on the hook because they chose not to make sure they're meeting the needs of young people. And again, I can't stress it enough. As a greater system, we have to make sure that we're always keeping young people at the center of the conversation and not necessarily our fears. So are there any questions about that?
So George, I can see there's a question from Sarah.
Sarah Potter? Okay. Can we get her unmuted? I don't want to have to.
Yep.
Hi, can you hear me?
Yep.
Yes, I can.
Awesome. Hi, George and Celeste.
Hello.
So one of the questions that I have, and one of the things that we're seeing here in California with our continuum of care reform, is the group homes are required now to be licensed by the Joint Commission, and it's a very long and lengthy process, and it's also a very expensive process. And so those who are smaller group homes who don't feel like they can afford it, or they fear that they won't pass the Joint Commission accreditation, they are shutting down. The state has implemented an extension, so they have they can file for, I believe, a 2-year extension while they work on their accreditation. And I was wondering if that was something that was being considered in the Families First Act. Were they offering any sort of extension so it's not an immediate shutdown of some of the smaller group homes and those who are really fearing this accreditation process?
Yes. So there hasn't necessarily been a specific extension process that has been discussed. However, most of these provisions regarding congregate care do not go into effect until 2019.
Okay.
And a large part is that because there obviously has to be some time for implementation, right? Give states the opportunity to get a plan together. So there is a process in which we understand that there's going to be an increased need for re-navigating how our foster parent population, because we now have to shift that focus. And so I think one way to look at it is that accreditation is the means by which we hold people to a common standard and framework, right? So for folks who are in education or have gone to any high school, secondary school, post-secondary school, it's understood that if your school is not accredited, you probably do not want to go to that school, right? Because there's no larger body that is holding you accountable. And it's really important. And I think folks in Congress are aware that overnight you can't expect group homes to just automatically seek accreditation. But I think there is an opportunity to say, all right, in the 3-year period, you've had an opportunity and chance to meet the care required and the standard of care that we would want for our own children. That was a great question. Thank you for that, Sarah.
Thank you.
Yeah. Any other questions?
Yes, so I am going to unmute now Michael.
All right.
Michael, you should be on. Can you hear us?
Yeah, I can hear you. That is super cool. Okay. Okay, you can hear me. Okay. I heard you, George, when you mentioned that that it's not that the group homes would close down, it's just that the state would have to fund the group homes because they wouldn't get a federal reimbursement. Is that doable, or is that something that the states are budgeting for? What does that look like?
Yeah, so I think that's a really great question. And so just to repeat, his question is about, is it possible for a group home or states to continue to fund group homes without federal reimbursement? And I think the general answer is that's a case-by-case question. So a state like California that has not spent more than it has been allocated. California has been in a special pilot program where they receive a pot of money for foster care based on prior year dollars, and they have never run out of money, which means that at the end of every year, they've had more money to put back into their state's general fund than they spent on foster care. And so in terms of what the reimbursement looks like, it's important to realize that the federal government is only going to, if a child is placed in a group home when they shouldn't be in a group home or residential treatment facility or other congregate care placement, that the state is actually only, I'm sorry, the federal government is only going to deny reimbursement for the foster care maintenance payment, which means that reimbursement for social workers, therapists, wraparound services, and general foster care operating services for that child's proportion of those services remain intact. The only thing that they're not paying for is the rooming and boarding of that child in a group home. And theoretically speaking, and kind of in a more general sense, the services and amount of money that a state misses out on ends up being maybe for, say, a child placed in a group home in California is anywhere between $750 and $1,500 per month per child that's inappropriately placed. So in the scheme of things, because of the other alternative routes of placement, and also an important part of this reform to congregate care is understanding that there are specialized populations, right, that have maybe there are 4 kids in a family, and they're traditionally in California, I would say you can have a maximum of 5 kids in your home, right? In most states, you can have up to 5 kids in your home. Through this law, it will allow states to expand the maximum kids in a family-like setting in a foster home, so they don't have to say, well, in order to keep these 5 kids together, we have to place them in a group home. So it will also allow for states to expand the capacity of existing foster parents beyond just 5. Great question. Thank you for that.
George, if I could tack on, I want to make sure, I think everybody, and Michael, I think you're already aware of this too, but I also want to make sure that federal funding will still be reimbursed to states for young people with a demonstrated need to be placed in congregate care. So young people with medical issues, serious behavioral issues that can only be contained in a congregate kind of setting with more supervision, or young people with mental health needs. Those are all still reimbursable in group home and congregate care settings.
Okay, one more question really quickly. What would be the max amount of youth allowed in a family-like setting? Is there a number for that yet?
I think that's a case by case, right? So it won't necessarily be a general waiver, but if there is a need for a family to take on more than what's been traditionally allowed in their family. So again, to give the general example about a family, say there's a family of 6. Well, traditionally a foster home couldn't be licensed to take more than 5 children. And so it's all, whatever is in the best interest of the child is what's always important. So if it's in the best interest of a child for a foster parent to be able to take 7 or 8 kids, and social workers, judges, and everyone else in line has said, hey, this will be best for the child, then that will be allowed. The federal government's not trying to be involved in, a pseudo system involved in every single step, but provide general guidelines that provide for the best outcomes.
And specifically, George, one of the things I think that's interesting about Family First is there is specifically, and I can't recall exactly how it's written in, but the provision is written to particularly take into account sibling groups. So let's say a family already has 5 foster children and is asked to take in a sibling group of 4. usually that would have put them over sort of the magic number of 6 that might qualify them as a group home, and in this case they would not lose their family foster home status because they took in a sibling group. At least that's my understanding of the provision.
No, that's correct.
So you have another question from Jewel. So Jewel, I'm going to be unmuting you. Jewel, can you hear us?
Yep, I can hear you. Can you hear me?
Yep.
So my question kind of comes from the fact, like, if in my sister's case, she was thrown more around the institution just because no foster home wanted her, what happens in those cases? Are the states then reimbursing, or are they just saying, well, now the state has to pay?
That's a really great question, and thank you. So again, I think what's the big part is that if it's that if they can't find a familial match, like a family-based setting, from what I'm understanding is that's not a qualified placement in a group home, right? That's just saying, well, we couldn't find an appropriate foster home for you, so we're going to just shuffle you through group homes. If there's no kind of qualified need from, say, a mental health professional or a medical doctor or some type of external practitioner that says a group setting is the best setting for this young person, or a residential kind of facility is the best setting for this young person, then yes, states would be on the hook for the foster care maintenance payments. They would not be reimbursed.
And if I can add on, George, to that, I think that, Jewel, this Family First is, frankly, a lot of the ideas behind it would be made for a situation like your sister's. I think what we're trying to do is incentivize states to work harder to find family situations, particularly for older youth. I think a lot of times older youth are sort of placed into that category of not being able to be placed in a family. And what we're looking to do is make states work harder to either find suitable relatives or recruit a family for a young person like that.
Yeah, I can't stress the importance of that enough. It's to de-incentivize the warehousing of young people or just shuffling. It's really try harder, right? If you think you've tried as hard as you can, try harder.
Jewel, did that answer your questions, or do you have another question or comment?
Question kind of on that. So if the foster gets placed in a setting that's congregate care or a group home that shouldn't be there, and the state gets on the hook, are they then going to try and actually find a spot for that youth to actually go then?
So just so I make sure I'm hearing your question clearly, so you're saying if they cannot find a family-based setting and the state is on the hook for funding the congregate care facility, is the state required to find them a family-based setting? Is that what you're asking?
Kind of, yeah.
Yeah, so no. The simple answer to that is no. The state will not be required by law to find them a family-based setting. However, what we have known in kind of all types of legislation is that dollars, talk. And so if states are having to fund the warehousing of kids in group facilities, then they're incentivized to not do that because it becomes a major strain on the state's general budget, especially in a time as now where most states are strained. So, and I think that's important because it's not saying that congregate care facilities are being shut down if they're, or states aren't being necessarily penalized for not finding a setting. They just won't get room and board for that. So states will just have to say, hey, we tried our best and we couldn't find a place, and they'll have to fund it themselves. But it's more than likely that states will try harder to to find families for young children and teenagers. Did that answer your question?
That answers it.
Awesome. Are there any other questions?
We have a question from Lexi, George. Lexi, you're unmuted.
Hey, George. Can you hear me?
I can.
Okay, I just want to make sure my mic was working. I just wanted to know how you might respond to a person in foster care or an alumni who says that they oppose the Family First Act because they had a good experience in a group home, or maybe because they had bad experiences in foster homes.
So, I think, one of my first kind of things would be to understand that it's the Family First and Prevention Services Act. So I've actually spoken with young people who are opposed to the Family First Act, kind of at some level because they had, they couldn't find a match in a foster home, and group homes seemed to work out best for them. But when posed the question, was there something simple that could have been done to keep you at home with your family? And it was like, yes, if we could have just got some family counseling or some services beforehand, then the idea of needing a group home would have been in the picture, right? And so I think if we're working harder as a global community to make sure that we're finding foster homes and working harder to find a match, right? Because it's been all too easy to just say, all right, we tried high foster homes, so let's put you in a group home and call it quits. No, work harder to find a family setting, and that could have been potentially be the family for this young person for the rest of their lives, right? Because often in group homes, they're paid staff, so they come and go. The idea is that we want states to work as hard as possible to make sure they're finding permanent connections to family for specifically older foster youth that tend to be the ones that are shuffled in and out of group homes. So I hope that answers your question.
Yeah, I've asked that question to several people. I think that's the best answer I ever got.
We're glad I could articulate that.
So another question is from Maria, George.
All right.
Maria, you're unmuted.
Hi, George.
Hello.
Okay, so you've mentioned how the threshold for congregate care placement is like a demonstrated mental health, behavioral, or even just physical health need.
Yes.
So, you know how foster youth are disproportionately diagnosed with mental health disorders and prescribed psychotropic medications. So I was wondering if there's a threshold that makes it so that you qualify for congregate care placement.
So I have not seen a specific threshold. I think one of the big kind of factors in this legislation is that it requires an independent analysis of the young person. So as of now, most of the kind of mental health professionals that would be saying the qualifications for qualified mental health, whether it be ADHD, ADD, or whatever other acronym they would like to come up with in that moment. So this legislation is saying no, you can't have an internal person do that analysis. You must have someone externally to do that analysis. And so I think it provides some level of oversight to make sure it's not just an internal process in which we say, all right, this person suffers from PTSD, so they should be in a group home. Well, no, and even if they did say, all right, they suffer from PTSD and they should be in a group home, well, what's the plan to get them out of the group home? Because so it's not saying that, all right, there's no possible way folks could need a group home. Maybe, there should be, and there could be a need initially, but every 12 months, once every 12 months at minimum, states are required to continually prove the need for the continuation of congregate care. So even at the beginning stages, if a kid is initially placed in foster care and they should be placed in group setting, they have the burden of proof consistently. So that would also help. Say they get the initial period at which they'll have 6 months initially to prove that the kid should be in a congregate care facility, and then after that, if it's determined they should be, every year they have to kind of remake that case for them maintaining placement in a congregate care facility.
Okay, and who is the like overseer that makes the first call?
I mean, those initially, at detention, the folks on the front lines are the ones that make, the call at the initial detention of young people who enter foster care, right? Because it's important to know that the people on the front lines are the people most qualified in those moments to make their best judgment calls. But eventually, initially they could be placed in foster care, whether it be through removal by a peace officer, there could be a social worker, it could be in the hospital, it could be a call from, school administrators, et cetera, et cetera. So those kind of initial placements in foster care, those routes remain the same for entry to foster care. But what happens is, as they go through the judicial process of, actually placing a young child in the actual dependency courts and things to that effect, that's when those decisions have to start being made about what's the best plan of action for this young child, and understanding that the families are first. So what can we be doing to keep this family together if there's no immediate danger to the child's well-being, emotionally or physically?
Okay. No, my question was, who makes yes, this young person needs to go into a group home? Is it like a medical
professional? Qualified medical professional. So that would be either a medical doctor, a therapist, a mental health professional.
Okay.
So someone other than a judge, other than a social worker.
Okay. Do you think that they're getting training on this legislation? Also?
They're independent, right? So these people who would be responsible for making those decisions are independent of child welfare, and so they don't have their priority is the child, right? So what's the best course of action for this child's physical and emotional well-being? And so, mental health and medical doctors are very, very active in understanding the development of children, emotionally, psychologically, mentally, and physically. So I think because of their unique practice area in maintaining the well-being of children, I would say they're the most qualified to make judgment calls on kind of the physical safety of children and emotional safety.
Okay, thank you for that. And I don't know, I just really want to add, because California did mandate therapy for foster care, foster youth. My therapist wanted to put me in an institution, but it was my lawyer who stopped her, my attorney who stopped her from doing that. So I just want to know if, they, what that landscape also looked like. Thank you.
Yeah, no problem. And I think it's important to know that it's also it's requiring a shift from internal, therapists and doctors and things like that to independent folks who aren't making a living off of consulting state or local child welfare agencies. And thank you for that.
We have another comment and question, George, from Sarah.
All right.
Sarah, you're unmuted.
You there?
Oh, let's see. Sarah, can you hear us?
Okay,
Now we can hear you, yes.
Sorry, I was muted twice. Apparently, I muted myself too. So this is a little bit of a long question, but I've been reading some of the criticism of the legislation from different states and various advocates, and I'm curious what you would say to advocates in places like California and New York who oppose the legislation and believe that it either undermines their own continuum of care efforts or results in the loss of hundreds of millions of dollars, especially since those dollars can't be redirected to provide services in family-like settings. So I think that there's a fear that, A, it's undermining other states' more progressive continuum of care movements, and also it's removing a lot of dollars that are not going to be reallocated. They're just going to be gone. So what are kind of the thoughts and comments around that?
All right, so first I think, my first comment is about understanding the big issue that has affected the United States of America since its kind of founding, and that it is the desire to have independent countries act together, right? And so having states' rights versus federal rights has always been an issue in this country, right? And so a lot of what happens is that whenever there's a federal regulation that happens, almost always states oppose, right? Because as we know from our history and civics courses, states just don't like the federal government telling them what to do. That's why we've created, the House of Representatives and the Senate in order to make sure states have a voice in what is happening to their local economy. And so that's the first part. The second part is that it's not a loss of dollars. It's a reallocation in which of the way in which funding is administered. And so, states like California, Texas, and New York have all been getting waivers to provide prevention services for the past few years. And so what it's saying is that we're now going to be incentivizing states to prevent foster care, right? So what do we do to make sure we maintain biological and adoptive families to begin with, and not just making sure that, initially you have to remove a kid from their family before you can start providing services to their child or the child's family. So now it's saying, okay, we're going to be, instead of giving you money to warehouse kids in foster care, we're going to give you money to now prevent foster care. And so it actually kind of levels out the playing field in which we're operating, if that answers your question. I hope it does.
Yeah, I think that I was under the impression from what I've read that not all of the money that's removed or, states are losing as a result of no longer being able to put youth in group homes, which I'm not stating an opinion on that. I think that that's a smart thing to do. But I was under the impression that not 100% of those dollars are being reallocated to prevention services. I was under the impression that it's just a fraction of those dollars.
Yeah, so what's happening is that now any child, so this law will say that any child who would be a candidate for foster care, as long as, the state deems that their family setting isn't placing them in immediate physical or mental danger, if they would be a candidate for foster care, they will now be a candidate for prevention services. And there's not some big pot of money that the government is taking away from states. They're not saying, all right, we're taking this money from you for congregate care. It's saying, no, we're going to give you 3 years to get your act together to figure out what your plan is. And then we're going to stop giving you room and board payments. So all the other services around taking care of that child that is in a congregate care facility inappropriately will still be there. They'll still pay for the social workers. They'll still pay for the mental health professionals. They'll still pay for everybody else. They just will not let a group home profit off of a young person being in their care inappropriately. So they're not taking money away from states. They just won't be reimbursing states if the placement is deemed inappropriate. So if a kid is 18 and they're in transitional housing, which is in a group-based setting, so in California, places like First Place for Youth that are technically group-based settings, that would still qualify for federal reimbursement dollars for room and board, as well as all the other money.
a piece I'd like to add too, and Sarah, just so you know, George and I are actually going to be in California in a week because we are going to meet with some advocates to better understand some of the criticisms. But overall, one thing I think is important to understand is that lots of states, including California, have been working under a demonstration program called the Title IV waiver program, which, you know, that demonstration program is ending. So in 2019, I think, is the date that all the waivers will end and cease to. So waivers will go away, and I think that is one thing that some advocates maybe don't understand, is that the waivers that they're operating under currently expire, and we have very clear messaging from the Senate that they will not be renewed, which means lots of the great progress and programs that states have implemented under waivers will be defunded altogether. So I think there may be some concerns that the Family First Act maybe is a little bit different than some of the waiver kind of offerings under the demonstration program. But I think it's really important for people to understand that the waivers are going away. And so that if we don't implement something to replace them, we will be backtracking a lot. So I think that's I don't know if that helps provide some clarification. And I think the question you're bringing up about for the progressive states, that specifically has been talked about with some of the very small group meetings with Senate staff and advocates. And it has been made clear to us, both by Senate staff and people from the administration, that the intention here is not to somehow penalize the states who've been very progressive and, frankly, led the way for Family First. That is not the intention, and that the administration is very interested in working with those states so that they do not have to backslide on the progress that they've made.
Great. Thank you so much.
Thank you.
I think we have another comment from Jewel. Jewel, I'm going to unmute you.
Hi.
Hi there.
My question is, so you get medical professionals that are quick to diagnose foster kids. They found it in a study that that's the case. Is there anyone that's kind of that's making sure that these medical professionals aren't targeting foster youth to say, oh yeah, well they need to be in a congregate care when really maybe they don't?
Again, I think that has a lot to do with implementation, but I would say I think again it helps that they're becoming now autonomous, in that now states would be required to work with medical professionals outside of their departments. A lot of times, I could see, if a therapist or a medical professional is making dollars or seeing patients on a continual basis and had maybe a contract with a state department or local department, they would be incentivized, right, to provide these services. But again, but it's important to know that states are required to create a plan of action that puts them in a family-based setting, right? So if they said, all right, this doctor has said they need to be in a group home. All right, well, what's your plan to integrate this child into a family-based setting? So you're not, they won't be allowed to just say, all right, nope, a doctor said they should be in a group home and that's the end of that conversation. No, a judge is going to always be checking in to make sure that, that there's a continual need and there's a continued plan of getting this child integrated into family-based settings.
Sounds good.
Yep. Thank you for that.
Okay, George, I think you can march ahead. I think we've covered so far all the questions that we have.
Awesome. All right, so I guess as we move forward, are we all there still? All right. Are we still there?
We still have you, yep.
Okay, cool. Sorry, I saw the little spinning wheel. I got scared for a second. All right. So what's next? So on June 21st, the U.S. House passed the bill by voice vote, and the Senate is now considering it. And so I'll talk about a little bit what that means. So there are a couple ways in which legislation can be passed in Congress, either by unanimous consent, which means that everyone pretty much agrees, there's no objection, so the bill becomes just moves through both houses and goes to the president's desk. There can be a voice vote, and a voice vote does not necessarily mean all members of the body voted. It means that it was on the calendar for a voice vote, and if you would like to vote on it, you must be present. And then there's a roll call in which every member, so in the House, because it's really large, they all vote electronically in a box. You know, they have a little voting machine. And then in the Senate, they actually, when they do a roll call, they actually will call each member, which is 100 people, by name for a verbal vote out loud. So it passed in the House, and it moves over to the Senate. And the Senate, in order for it to move forward to the president's desk, the Senate must pass an exact version of what passed in the House. They initially were trying to get it passed via unanimous consent, but unfortunately, the bill has been hotlined, which basically means that any senator can say, no, I disagree, which means there's no longer unanimous consent, which makes the bill has to go up for a debate or further consideration, whether it be on the Senate floor or private offline conversations, and then it has to be brought up for an actual vote. So as of now, as we all know, Congress is on recess. So all the senators and representatives are usually back in their home district. And although we call it recess, they're not on vacation. They're just not in DC. So any questions on that before we move forward to what we can do? And I'm actually going to hop out of here because I think our team put together a really awesome document I want to show you all if I can get it pulled up. Here it is. All right, so we're going to send this around to you all. I think either Brian or Celeste, are you going to send it via this webinar? If not,
we'll send it as an email follow-up after this webinar.
Yeah, perfect. Thank you. So here's a few things that we can do. We're going to have a letter of support that we're going to reach out to. I know a lot of you all were invited to this webinar because you signed on to a letter of support that was on our website. And what we're doing now is we're working on an additional letter that will either be emailed or I will most likely hand deliver to members here in DC, because we really want to make sure that our senators are seeing that young leaders and advocates and supporters are signed on to this and are pushing this forward personally. And so my email is in here if you would like to be included. And again, this will be sent out after this webinar. The next thing you can do, yes.
I'm sorry, I was just going to add to that, George, that for those that work with youth boards or youth groups or alumni groups, I think to have official sign-ons from your group or organization would be helpful. We can actually add you. There's an official organizational sign-on letter, and we can add the name of your group to that list as well.
Yes, thank you for that. And I think community is extremely important in getting, even if there's someone, in your life that's really important to you, they can sign on as well. There's no limit to who is allowed to support legislation. Next, call your representatives and senators. You can go online and find out who your exact representatives and senators are. And when you call and email them, the staff will track down and make notes of everything you say, and that works. When Congress members see that people are calling in support of legislation, they're inclined to support that legislation. If they see that people in their districts and people that vote for them are supporting a piece of legislation, they will be more inclined to also make sure they vote in the affirmative for that as well. And so there'll be a link in there so you can go online, put in your address, and find out exactly who your representatives and senators are for your district.
Hey, George, I heard sort of a fun stat. I don't know if any of those of you, I know we have some people on the line that actually worked in Congress, but I actually heard that offices sort of do some simple math. They figure for every call, every person who actually calls in, it represents 1,000 people who care about that issue. I thought that was sort of an interesting way to think about it.
Wow. Yeah, I haven't heard that, but that sounds cool. I mean, I've been in a Congress person's office, and I'm telling you, like, I remember I got a box that literally had about 500 letters in it, and I scanned every single one of them to the legislative director. And so, a lot of people think, our voice doesn't matter, and they don't listen to us and things like that. When someone has to, scan all those letters and listen to all the calls, the members listen and they pay attention to those things. So the next thing that we're actually going to be hosting is a creative expression contest, and I'd love Ryan to really talk about that.
Yeah. Can everybody hear me?
They won't be able to respond.
We can hear you.
All right, good. So where are we at? George, can you bring up maybe that one web page that?
Yeah. There we are.
So people can see. So this just got created today, and it just kind of goes through the whole creative expressions contest, and the theme is kind of what family means to me. So we're looking for youth up to ages of 24, experience in care, who can kind of follow the theme of what family means to them, and it can be any form of art they want, whether it's poetry, music, painting, drawing. We're open as long as it falls underneath the creative category. And so the rules for that, I just said basically 20, that's the main rule right there, is you got to be 24 and under, and all those things. Additional guides or guidelines, we're hoping that everything comes in by the 20th. So if we start broadcasting this probably tomorrow, then hopefully we start to get submissions in all the way through the 20th of this month, and we'll be able to display those on our website, or at least the number one winner, we'll be able to display that one. There's more guidelines there. Actually, George, if you could if you don't refresh it. I added my email or the email address that we're going to use for the contest on there. It's just contest@fosterclub.com. So right there under where was it? Entry instructions right there before the so submissions must be submitted by email. I did put the email address in there. And if anybody going through this sees any typos, please let me know. There shouldn't be any on there though. So that's what it is. So hopefully if everybody listening to this right now either fancies themselves as an artist and has something that they would like to share that kind of conveys the feeling of what family means to them, we'd love to have submissions from all of our closest young leaders as possible, or circulate that in your own network. We have memes and whatnot that you could easily click on and share and let people know that there's a contest going on. And bonus, number one prize gets $100, I believe, is it a gift certificate or a prepaid Visa card? Like I said,
Visa card, yep.
Prepaid Visa card, $100, and then we go down to the third place winner for prizes as well. So $175.50. So there is incentive, but we're really hoping to get at least a few pieces in here that we can really showcase and kind of, use it to piggyback on the momentum we're trying to get for Family First.
Awesome. Thank you for that, Ryan.
Thank you, George. Thanks, everybody.
And so I guess moving forward, if there's a story you really want to share, and you would like to write a blog post on maybe the Foster Club website, if you want help with figuring out ways to contact your local newspapers, to write an opinion piece, you can definitely reach out to me directly. I will graciously and willingly help you on figuring out the best way to go about that. That's part of why I'm here, to make sure I'm helping support you all in the work that you would like to do, because it's about you all, not necessarily me, although sometimes I like it to be about me. And lastly, share it on social media, Facebook, Twitter, Instagram, and all the other avenues in which you like to share. We have the hashtag Family First. And an interesting thing that we found out recently is that Congress members and senators really love when you target them specifically in your wording. So, you find out who your representative is or your senator, and go ahead and, tweet them and make sure you directly at them. I think that's what it's called. At them on Twitter, and, let them know your story. And if you want help in, figuring out some type of, media campaign online on social media that you want to do, please reach out to me, and I'd be more than willing to help. So that is our hour. If there are any more questions before we go, I'd love to hear them. Last thoughts on suggestions on how you can be involved, any ideas on other folks being involved. We'd love to hear them before we end the call. If not, we're going to call it a night.
And I'm actually just unmuting everybody, so people who would like to speak up, please. I'm unmuting you quickly as I can. So if anybody has anything to say, you should be unmuted, but we're going to have some background noise.
Hi, Celeste. This is Shay.
Hey, Shay.
How are you doing?
Good, thanks.
Good.
Any last questions?
Yeah, this was really helpful. Is there going to be like another info session?
Yes. We do not have a specific date, but we're definitely going to be continuing this conversation as we move forward throughout recess and kind of all the way up until we get a vote on this. So as soon as we have a date on our next info session and what that would look like, we definitely will send that out.
Alrighty, thank you. Also, George, it's always good to hear from you.
Yeah, as well. Good to hear from you as well. Anyone else before we call it a night? Speak now or email me later.
Thank you so much.
Alrighty, well, I'm going to go ahead and end our call. Great night. Thank you all for joining.
Thanks, George. Thanks, everybody.
Thank you.